Welcome back, everyone. Dr. Pamela Gardner is with us today, cardiologist from Lima Memorial Heart and Vascular Institute. We're talking a little bit about heart disease. February is that month when we focus on it again, especially when it comes to women. And I know you've talked about it's one of the leading causes of death for both men and women. But we talk about heart disease. Are there risk factors, things we need to think about in our everyday life?
Absolutely. Very simple things like one of the most prominent things, your family history. Paying attention to that. If you've got a family history of somebody having an early heart attack, you need to be paying attention. Smoking, if you do it, get rid of it. Big risk. Exercise is good for all of us. We need to move. We're meant to move. Your cholesterol is super important. Getting that bad cholesterol down. If you don't have documented heart disease, at least down to 100. And if you do, it should be 70 or less. If you live in Europe, 50 or less. We're getting much more aggressive with the cholesterol because we know the bad stuff is what puts the blockage into the arteries. So all those things, we need to be really paying attention.
Yeah, I know you've talked about it, as you mentioned, the genetic link to it. And we see so many people who will say, hey, my mom or my dad or my grandfather, that kind of thing, had issues. And like you say, if you start early and say, okay, I know I've got this extra risk, if you start early, you might be able to prevent some problems, right?
Start early, pay attention, and optimize all the things you can.
Yeah, it makes sense.
Yeah.
Well, and you've talked about heart attack risk too, and it was something I didn't really know until a few years ago, but the signs and the symptoms can be a little different for women and men. Talk about some of those and what women might look for.
Right. So we all can have the chest heaviness, common Elizabeth chest pain sort of thing. That can be man or woman. But ladies sometimes will only have something like fatigue and shortness of breath. They're vacuuming and just hit the wall. They stop, they rest for a couple minutes, they can go again. My mother-in-law had a heart attack. Her discomfort was pain between her shoulder blades. She didn't have the stuff in the front that we typically think of, but it would come on when she was active, go away when she rested. It can be discomfort in your neck, your jaw. Someone near and dear to me had a heart attack, his right eardrum burned. That was his angina. But it came on when he did something, went away when he rested. That's what you need to be looking for, that pattern, especially if you have that and then you start to become sweaty, sick to your stomach, short of breath. Put that constellation together and you really need to be thinking, is this my heart? It's easier to check it out and say, no, it's not, than it is to say, uh-oh.
Yeah, and I think the stereotype version is if we're having a heart attack, it comes on in a couple of minutes and then we're in big trouble. But you've talked about this before. Those symptoms can go on for days and even a couple of weeks at times, right?
Oh, it can. You can have the symptoms, I better be paying attention early on symptoms way before you actually have the heart attack. So if you start noticing that, let's check it out before there's damage. Your heart can be saying, hey, something's wrong here, and trying to tell you. One thing that people will confuse it with is esophageal stuff with acid reflux and that kind of stuff. And it can be really difficult for us to tease it out. So I have a hard time teasing it out. Don't expect yourself to just go, yeah, that's all it is, and blow it off and then end up with a very sick heart in the end.
Yeah, and the nice thing is you guys have gone to this a few years ago where we can do same-day meetings up with you guys to kind of fight that off, right?
Yeah. So what we have is a same-day a clinic where you can call the office and say, you know what, I'm having these symptoms, that something's wrong, and you'll come in, you'll initially see one of our physician's assistants and then the physician here in the office, so that we can get you on the right track before there's a disaster.
Okay, help is available. The number is on the screen. Dr. Gardner, thank you so much. We appreciate it.
Always my pleasure. Thanks.
You bet. Nice chatting with you. We'll be back right after this.